speech pathology. So if you're like me, or me I should say, as a parent, you sometimes get really stressed and really anxious when you're taking your child to a medical appointment because you think, what's going to happen? Are they going to poke, prod? What are they going to do to my child? If you're concerned about taking your child to see a speech pathologist and to have an assessment and you're not sure what's going to happen, then stick around because I'm going to let you know. Okay, so the first thing is, if you're bringing your child in for an assessment and they're not yet started school here at Chatterbox Speech Pathology, you don't need to be stressed and you don't need to be anxious. We're not going to be wearing lab coats, we're not going to be poking, we're not going to be prodding. What we're going to do is you're going to meet a really friendly speech pathologist. They're going to say hi to you and your child. They're going to get down at your child's level and they're going to maybe play some games with them. When they're playing those games, you're not just paying for some expert to sit there and play. When they're playing, they're actually looking to see how is your child communicating. And that means they're going to look to see how is your child understanding the instructions in those games and how are they talking in those games, as well as their social communication skills. So things like, are they looking over here and talking to you? Are they using a quiet voice? Are they using a loud voice? Are they answering questions? So that's going to be the first part. Then, depending on your child, the assessment's going to be tailored a little bit more to look at their speech sound development. And what that's going to involve is simply looking at pictures, labelling them, and as a speech pathologist, we write down in our own code how your child has pronounced those words to decide, are their speech sounds appropriate for their age or not? Then what they're going to do is they're going to do something that's called a standardised assessment. Now, that's just big fancy words for they're going to do a test with your child. And again, it's not stressful, it's not hugely concerning. What they're going to do is get your child to look at some pictures, answer some questions, maybe label the pictures, follow some directions with those pictures by pointing to them or pointing to them in a certain direction or order. And from the results of that, they're going to compare them to other children the same age as your child. And that's going to tell us, how is your child doing with their communication skills? Then the speech pathologist is going to put all that information, so that play, the speech sound testing, their language testing with the standardised assessment that's looking at their understanding and their talking, as well as the most important thing, talking to you about your concerns. And then they're going to let you know at the end, is there a problem? Are we the right place for you? And can we help your child? So you don't need to be stressed. We're going to be using games. We're going to be using toys. And you never know, your child might even get a little lolly or sticker at the end. So you don't need to be stressed. I hope that helps you guys to understand a little bit more about what's involved in a speech and language assessment. Thanks, guys.